Okay, Hariom everyone. Namaste. My voice is audible and screen is also visible to all.
Yes, ma'am. Yes, ma'am.
Okay. So now today we'll start with a new system, that is endocrinal and metabolic disorders. We'll go for endocrinal and metabolic disorders. Yet now, how many systems we have covered?
Two. Two,
So
ma'am.
can you name?
Ma'am,
Respiratory, cardio.
respiratory and cardiovascular.
Yes. Okay, so we have completed with respiratory disorders and cardiovascular disorders along with their management. Now we'll go for endocrine and metabolic disorders. This is the third set in our syllabus. First disease for endocrine and metabolic disorders will go for diabetes mellitus. Okay, so we'll go for diabetes, commonly known as diabetes. Okay. So first of all, the main organ which is related with our diabetes is pancreas. All of you know, very common disease nowadays and also very like harmful. So pancreas is most relating organ with the diabetes. So what is pancreas? First of all, not required, but still for little knowledge. Soft, lobulated, elongated organs. You all know that diagram of that you used to say, na, like it's a bad diagram, but it is similar to like this shape. Elongated gland with both endocrinal and exocrine functions. Endocrinal functions, which means directly they are supplying hormones or anything into the bloodstreams, and exocrine ones are through the duct they travels all the hormones and materials into the bloodstreams. So therefore, these endocrinal are also known as ductless glands, as they are not using duct to travel material or substances into the bloodstreams. Okay, the example is endocrinal because this pancreas is the one which have both the properties, endocrinal as well as exocrinal. Okay, so the hormones which it release like insulin and glucagon are in the form of endocrinal because they directly goes into the bloodstreams, and exocrinal gland which it produces are pancreatic juices and all, because they will definitely going through the pancreatic duct and then into the different other parts. Okay, now the length of the pancreas and weight. So the four main hormones which are somehow related to are this. One second. Okay, my voice is clear now.
Yes, ma'am.
Yes. Okay. So the four main hormones which are secreted by our pancreas is insulin, glucagon, ghrelin, and somatostatin. These two are the main focus of ours for today, because these are only which are related to diabetes mellitus. Okay, these are other because we'll see what is insulin and what is glucagon, and now ghrelin a little introduction. It is also called as hunger hormone. Okay, hunger hormone because it is responsible for that urge for food. Okay, like that, and also for the somehow in also the growth or height growth. Now somatostatin is also one of the hormone which is released by it. Some of the cells are somatostatin nothing but it prevents the release of pancreatic hormones, insulin and all, different hormones. Okay,
Ma'am,
yes ma'am.
what did you say about ghrelin hormone?
Actually it is called as because it is responsible for, it gives the urge for hunger. So it is also called as, then in simple terms we used to call as, this is written na, hunger hormone. Okay. So just to tell you a little about this, otherwise these two main are the focus for today's. So now these are the, as I told this, that there's different hormone, glycogen, glucagon, insulin, and somatostatin. These are the cells. They will directly release into the bloodstreams. Okay, into bloodstreams. Now there are certain cells also, certain cells of alpha, like you can understand by this, this blue color indication shows that this glucagon hormone, because our pancreas have different cells. Okay, I will show you. There are different cells. Some cells are alpha cells, beta cells, and delta cells. Okay, we'll just see about that what exactly the function of alpha and beta, because these are also the most important for today's class. Alpha cells, what they did, alpha cells did, this blue color indication will be glucagon. Okay, so alpha cells releases glucagon. Okay, and beta cells releases are insulin. This is related to this. Okay, so beta cell releases insulin, then delta cells releases somatostatin, not required. Okay, now other digestive enzymes are also there, and they will release into the duodenum, etc. So main focus is these alpha and beta cells of the pancreas, because pancreas have these cells. These cells further releases some hormones like glucagon, insulin, and somatostatin and ghrelin, etc. So you have to remember that what did alpha cells releases and what beta cells releases. Okay, main focus. So beta cells releases.
Insulin.
Yes. So first we'll see what is glucagon. Okay. So before this, we'll understand. Okay, no, in between we'll see. Okay, when blood glucose level falls too low, okay, or low blood glucose. So this glucagon is responsible for lowering down or our blood glucose level. How I will show you the whole scenario. So what happens when we normally eat the food? Our food will be converted into carbohydrate, and further for our body cells, it will be useful for our body cells in the form of glucose. Okay, our body will use it in the form of the glucose. So final product of that food will become glucose, which is useful for our body further. One second. So we'll eat food and it will convert it into the glucose. So what happens? Normally we are using the glucose when there is excess the glucose in our blood streams. There should be, and we don't require that glucose at that time. Okay, we are at the rest or any other activity. We are not doing so much activity, so this glucose is not required at that time. What happens? Our body take this glucose into the this glucagon itself is the one. This glucagon take this glucose into the what liver. Okay, this will take this all into the liver and store it there in the form of, anyone knows?
Glycogen.
Yes, very good. है ना? So this is very easy if you all will know. You have studied the anatomy, so must you have understand this. So, but still, I will tell you that when excess glucose will be there, glucagon will take this glucose into the liver to store it for further use. Okay, for further use. So this is the main thing what glucagon is doing. So by this, it will decrease the level of glucose in our bloodstreams. Therefore, it is written that it low blood glucose. Okay, very simple. No need to understand that much. You have to understand only this. Okay, as it is taking glucose to store it into the liver in the form of glycogen, therefore it is lowering down the glucose level or less glucose level. It is okay. So the
So,
pancreas.
hello.
Yes, sir.
So, when the blood glucose is low, so thereby the glucagon stimulate the liver to secrete the glycogen, right?
At the time when there is low glucose level.
When the blood has a low glucose level, thereby the pancreas secrete the glucagon. That glucagon stimulate the liver, right?
Okay, yes. So what happens in glucose? Actually, glucagon normally increases the blood sugar level. Okay, sorry. The exactly the function of insulin I am telling you. So glucagon, what it does when there is, sorry, this is my mistake. When less glucose is there in the cells, it converts this glucagon into the glucose. Okay, therefore thereby it increases the glucose level. Pancreas, sorry, I told you that is same exactly of the insulin. Insulin decreases the level of glucose. Okay, and this increases the level of glucose. So now again I am explaining. By mistake I told you like wrongly, because I thinking that I'm telling you that insulin. Okay, so what happens when there is a less glucose level? Okay, this is written that glucose level is too low. Okay, when there is low glucose level, at that time what happens, these are pancreas or it will send glucagon. Okay, by which cells glucagon is released?
Alpha cell.
Yes, very good.
Alpha cell.
This alpha cells at that time when there will be less glucose in our pancreas, in our bloodstreams, these alpha cells of pancreas will get activated, further release glucagon. This glucagon will goes into the liver and convert that stored form of glucose in the which is in the glucose is stored in the form of glycogen into the liver. It will break down that glycogen and bring that glycogen in the form of the glucose back to the bloodstreams. Therefore, it is said that glucagon normally increases the blood glucose. Okay, now it is under like it is clear, or again I need to
Yes, ma'am.
understand. It is clear. So actually, I am saying that again and again that there is it will increasing, it will lower down, lower down. I thought that I am explaining insulin. Okay, same exactly. Which I haven't make you understand that is insulin. Okay, so now for
Ma'am,
all of it, it is clear. Yes.
this glucagon is which is already stored, or is it in directly
Ma'am,
secreted by
I told you
pancreas?
na, this glucagon is directly released from the when our body will see that there is less glucose in the body, less energy in the body. What happens nowadays? Navratri also, if some people have fasting and all. What is that which is providing energy to us if we are not taking food? Matlab, like we are doing proper fasting. So at that time, this glucagon is only itself which is going. It is written in the next line. You can see during fasting also it helps to provide us energy. Okay, because what happens at that time, glucagon released by the alpha cells of the pancreas. Okay, so what happens then, our body is now the time of the fasting, our body is seeing that there is less glucose in the body. It requires energy. We are not taking any external food from outside. So at that time, the pancreas, our body will stimulate and send, our brain will send the signals to it, and pancreas alpha cells will get activated to release glucagon. This glucagon, just memorize this by closing your eyes. You will just visualize it, and then it will be easy to understand. Then glucagon will go to liver and ask liver, kindly give my glycogen, and because I require it to use for the use of the glucose. Then it will take glycogen. What is glycogen? Is the stored form of glucose. It will take glycogen, break down the glycogen, further convert it into the glucose and send it to the bloodstreams. Then our body will get energy from there only. How we are living, that's why na, because we are taking energy from there, stored, lots of stored energy is there. Okay, now is it clear, ma'am?
Yes, ma'am. Clear.
Yes, ma'am.
Okay, very good. This is one. Okay. This hormone helps blood glucose rise back up in multiple ways. Okay, there are two ways they have tell. It causes the liver to convert this stored glucose into the, what is this stored glucose known as?
Glycogen.
Glycogen.
Yes, very good. Into a usable form, and then because normally we want to use it. What is that usable form which our body required?
Glucose.
Glucose.
Into a usable form, and then releases it into the bloodstreams. A process called as glycogenolysis. Okay, this conversion of glycogen into this glucose. Okay, now glycogen also stops the liver from taking two things. The glycogen will do. First, it will break down the same thing which we have understand in backslide. So it will break down the glycogen and will convert it into the glucose. First thing it will do this, and another thing is glycogen stops liver from taking in the stored glucose. So more will stay in the, matlab it will start stopping, because when our body requires glucose, so glycogen will stop that glucose to go inside the liver in the stored form. Okay, so same thing it is happening again and again. The same final result is more glucose level in our body, which is required at that time. Okay, so hopefully it is very much clear to all. Now, second is insulin. What is insulin? So when everything is working well, insulin moves glucose out of the blood and into moves glucose out of the blood and into the cell where it is used for the energy. So which cell of the body this pancreas releases
Beta cell.
Yes,
Beta.
beta cells. So what exactly I'm telling you that when there is excess glucose in the simple terms, you have to understand. No need to learn even. Just visualize this. What happens when there is very high glucose in this our blood streams? So what happens are insulin comes. Okay, insulin pancreas again. Pancreas will get activated. The beta cells of pancreas now. The beta cells of pancreas will get activated. They will release insulin. Insulin will further goes into the blood streams and ask this glucose to go and stay there in the liver in the form of glycogen to be stored as for the further uses. Okay, so simple. Understand this. Simple. Not reading all this. You have understand all this diagram.
Yes, ma'am.
Okay, so again, I am repeating once more. You can hear very carefully. When there is excess glucose in our bloodstreams, what happens? The pancreas have beta cells. Beta cells of pancreas will get activated, stimulated. Further, they will release insulin. This insulin hates glucose. Okay, you can learn like this. This insulin hates glucose. This asks glucose to go inside the liver and stored there only itself in the storeroom in the form of glycogen for further uses. Okay, very simple. Insulin keeps glucose level from rising too high. The same thing.
And
Yes, ma'am.
if I'm not wrong, then insulin send glucose to the cells, right?
To the cells and also to the liver. So in diabetes we'll say that what happens because in this what happens this insulin cells send it to the this one are stored form also and to the cells also. In the cells there are the one receptor known as glut4 receptor which accepts the this glucose inside the cells. It is sent to the cells also and in the stored form also. Okay, we'll see
Right.
in the yes.
So insulin, we know that insulin also metabolize the glucose, right? Or insulin is the main cause for glucose metabolization.
Yes. So what happening in metabolization? Because when there is insulin in the body, there will be no high glucose in the body. So what happens? They just store there and send to the whole body also, all body cells also. Okay, in the two forms. How much our body cells required sends glucose to body cells, and then further it will store that into the this. That's why in the fasting it is helpful, na. Not whole glucose is used by the body cells. Okay.
Okay, ma'am, got it.
Ma'am,
Yes, ma'am.
I'm asking just out of curiosity. So this is the reason why people are caused from fatty liver. Like high amount of glucose gets stored in their liver. Uh, is that a reason for fatty
Maybe,
liver?
maybe, but I'm not that much clear about that. If you
Okay,
want,
ma'am.
I can just answer you tomorrow for this. Okay.
Okay, ma'am.
But for that, I that
Yeah.
this is the only reason that it causes that. Okay. So this is clear to you all. Insulin about insulin. Okay.
Yes, ma'am.
So now, here only you have to understand that as it is sending to these cells, on the cells there are GLUT4 receptors which are accepting this glucose through this insulin. Insulin goes and open that and send the glucose there and is stored in this. This is how it will decrease the level of glucose, high glucose in these blood streams. That's why to diabetes people we used to say they need to take insulin and all like that. We'll study in further slides. Okay, so this is how it is written. There's these two hormones. Which two hormones? Glucagon and insulin. This is how these two are maintaining the homeostasis or the counterbalance to each other. Okay, once if it is increased, the other one decrease. This is how they balances and maintain the homeostasis in the body. Homeostasis of glucose. Okay, now what is diabetes mellitus? Exact disease. For this disease, we have to understand those two hormones like very necessarily. And this is very important disease. You all should remember for whole lifetime and for all the exams related to therapies. Okay, now diabetes mellitus. The diabetes mellitus comes from the word diabetos and mellitus. Diabetos word means fountain of, and mellitus word means sweet. So fountain of sweet. Okay, this is how it is compared with its name and the problem. It is a metabolic disease characterized by the high blood sugar level, which results from the defects in insulin secretion or functions on both. So, or both. So we'll see that how many types, how it works. That when there is deficiency of insulin and when it is too much high. Diabetes occurs when the pancreas does not produces enough insulin. Okay, as I told that because insulin is the one reason that will decrease the glucose level, and if insulin is less, then definitely there will be high glucose in the body. Okay, or when the body does not uses insulin properly. Two things are there. When not enough insulin is produced by body, okay, one thing, and another thing is not used by the body. That mean that we'll see further. Okay, called insulin resistance. This same thing is called as insulin resistance. What? When the body does not uses insulin properly. What happens in our body? As I told you in before slide, that our cells have. This is actually the case of diabetes. Okay, what happens, the cells have this is like it is sending into the glycogen liver, and these are cells. The cells have GLUT4 receptors. This in somehow in one or the other way, what happens, these receptors are unresponsive to the insulin. Okay, once due to some reasons, certain reasons, this is unknown, I don't know, but there are certain reasons which are like maybe the sedentary lifestyle or anything like that, because nowadays everything, lifestyle, food, everything is changing. So this, due to which the immune system will be affected further, these GLUT4 receptors get inactive, or not even inactive, they are unresponsive to these cells. So they will not, even there is lot of glucose in the in the bloodstreams, still they will not accept glucose because this receptor is not working. If receptor will not work, they will not intake that glucose. If as there is inactivity of this receptor, there is lots of glucose in the bloodstream, still this the cells will starve for the glucose. The cells are starving for the glucose, though there is lots of glucose in the body. This situation, when our body does not uses that insulin properly, or body cells are not occupying that insulin properly, that's exact term is known as insulin resistance. To make you understand insulin resistance, I have told you, though there is lots of glucose in the body, still or bloodstream, still our cells unable to take it. Okay, this is the case of diabetes. We'll see which type of diabetes it is. Just 1 second. Okay. Now, for these tests, as we used to go for checkups of the glucose levels, so normal blood glucose for fasting blood sugar, when we have not eaten anything, at that time when we take blood sugar, that should be in between your one thing, again, 100 to 125 mg DL. So, and then further is postprandial. That means postprandial means after the meal. Okay, just after the meal. When it is just after this mg/dl is milligram per deciliter. Okay, its unit is milligram per deciliter. Postprandial means just after the meal. Okay, when we go for sugar level, that is called in short form we used to call FBS, PPBS, RBS. That should be 140 mg/dl. Okay. Then further milligram of deciliter. Then random, whenever like randomly, if anytime we'll take the sugar levels, it should be in between 80 to 160. Now risk
Ma'am, what did you told about postprandial after
just
the food?
just after the meal, yes.
Okay.
Yes. So this is simple, you have to just learn it. Now risk factors. No need to like focus too much on this, because I know I told you that only two that hormones, and then further disease is required. Okay, modifiable that we can change. Modifiable means that we can change, and we can change by our lifestyle management. Okay, high blood pressure, habits like these, smoking, drinking, and substance abuse, etc. Lack of physical activities, obesity, etc. Non-modifiable, that means we can't make any change in them. So age factor or family history, genetic factors, etc. leads to it. So now pre-diabetes. What is pre-diabetes? By the name itself, very simple, a condition which is most probably before the diabetes. Condition where blood sugar is high. Blood sugar is higher than that of normal blood sugar, but still it is less than that of normal diabetic to be called as diabetic. We can't even call them diabetic or can't even call them non-diabetic. So it is a middle state. Normal, it will be above normal and below diabetic. Okay. So it would be like RBS for this is 160 to 200 mg DL.
What is RBC actually?
Yes, sir.
What is RBC?
RBC, I am explaining
RBS.
the random blood sugar level. In short form, we used to call them FBS. Normally, everywhere you will see this FBS, PPBS only. Okay, and this full name is not written anywhere. Okay, PPBS, RBS, random blood sugar. Clear, sir?
Yes, ma'am.
Okay. So now now it is also now we have to see important part. Okay. Now classification of diabetes mellitus. There are two. That is type 1 diabetes mellitus, type 2. Most important. One is gestational diabetes, not so still required, but these are two. So type 1 diabetes mellitus. What happens in type 1? So previously it is called as this insulin dependent diabetes mellitus, IDDM, but nowadays no, it is now called as juvenile diabetes, which is related to child. Okay, juvenile word is for small children or children, okay, below adult age. So because people with type 1 diabetes rely on insulin, it was formerly called insulin dependent diabetes. Okay, it is completely depending on insulin. We'll see how. Since childhood, due to non-productive or little production of insulin, because what happens in this happens usually in the children's. Okay, it is said that in type 1 diabetes, it is said that insulin is not released by the pancreas. Okay, or the alpha cells. Of which cells of the pancreas are releasing insulin?
Beta cells.
Yes, okay, beta cells. So beta, and which cells are releasing alpha cells are releasing?
Glucagon.
Glucagon.
Yes, very good. So beta cells are not releasing insulin. By birth itself, it could happen. Okay, or if they are releasing insulin, it is too little that it is not getting useful for our body. Okay, type 1 diabetes is a T cell mediated autoimmune disease. Because it is an autoimmune disease, T cells is one of the like immune system cells. So T cell autoimmune disease is in which destruction of pancreatic beta cells. As I told you that beta cells are not releasing insulin by birth, or they are releasing too less, that it is not like fulfilling our body requirements. So there will be destruction of the pancreatic beta cells, which causes insulin deficiency. Definitely, if beta cells will be destroyed, insulin will be not released. So it will cause the insulin deficiency, which leads to hyperglycemia. What is hyperglycemia? By the name itself, we can understand high glycemia related to glucose. Because there is less or deficiency of insulin, it will lead to high level of glucose in your bloodstreams. This condition is called as hyperglycemia. This itself means high glucose level. Very simple term. Understand?
Yes, ma'am.
Okay. So now with the diagram, in first diagram we'll see this is type 1 diabetes. So what this is normal condition. Okay, what is happening? This is normal pancreas. It will release the insulin, and what insulin will do? This insulin will glucose will be sent into these insulin receptors are written that to these cells with the help of these insulin receptors on it. Okay, so now in second condition, that is type 1 diabetes, insulin is not released. This is crosses here on this point. Okay, insulin itself is not released by pancreas. Okay, insulin itself is not released by pancreas. So how the further work will able to do? So glucose also is inside the bloodstreams only. Okay, high level of glucose, it is not traveling to the cells. It will not travel to the cells. Why? Because insulin itself will send it to the cells. So more glucose level in the blood, this blue one, as it is more glucose level in the blood, it will further lead to this more glucose level condition is itself known as hyperglycemia. So just to make you understand this, we'll see first one only, type 1 diabetes. Okay. Now second, this is same as type 1 diabetes, not required that much. Age of occurrence is 2 to 5 years or near. Actually, what happens when I was in the diabetic section of when I was in SVSA, and in diabetic section, there is one girl very like very little. She is very little. So in her case also she is diabetic. So this one is juvenile diabetes she have. So by birth itself, I think so. No insulin is released for him when she requires that. So she feels very low and all. So the case of this childhood stage of juvenile diabetes, I have seen there only. So it actually
Ma'am,
yes,
can I share something?
yes, ma'am.
Uh, I also have a like lady. Her daughter had this type 1 diabetes. Now
Okay,
she's no more. Like
okay,
4 years ago, she passed away.
okay.
She was taking insulin daily, uh, but all of a sudden, within 24 hours, her blood glucose level gets very high. So, is there any like रीजनेबल कॉज और इट्स जस्ट दैट कि कभी भी हो ही जाएगा यदि किसी को टाइप 1 डायबिटीज है तो
Like that.
या लाइक ब्लड ग्लूकोज बहुत ज्यादा और उसका 24 आवर्स के अंदर ही बढ़ गया
Because
था
actually, at what that time it is happening that high glucose, excess of anything is high ना. अगर बहुत ज्यादा हो जाता है तो उनका मतलब डेथ का केस ये हो सकता है. Maybe their nerves burst off because there are many other complications of diabetes also that that leads to the nerves pain, neuropathy, nephropathy. All we have ना. Will not study in deep that, but still we'll see. So all these can burst their nerves and all that can lead to this because
तो
glucose is all over the whole body. It is traveling blood in all the blood streams, and it is all over, like in brain, everywhere in the whole body. That's
so even after taking insulin daily also like
yes, maybe the insulin which they are giving to her, maybe it is not enough to digest or to send that to the blood cells. That I'm saying, na, because what happens when insulin resistance happen? When insulin resistance happen, in that case, we'll see. In that case, actually insulin resistance mostly happens in that case. Our cells are also not getting glucose, though lots of glucose is there in the body. Still not taking glucose due to the inactivity of these receptors, insulin receptors on the cells. So that could be the case, and maybe required amount of insulin is not provided like that. But you are seeing nowadays that diabetes is could get the reason for the death also. So
yeah
diabetes also can lead to that. But juvenile diabetes is actually a more severe condition. It is said that maybe we can improve juvenile diabetes. It's okay, but curable is a little very difficult. Type 2 also takes times, but still we can say that it could be a little curable because it is by birth said or in very small age. It is said that's why it is very less chances to get completely cured.
yeah
Okay,
yes
so
ma'am
now this is a little data. 5 to 10 of the total diabetes are the total diabetes. Some people have type 1 diabetes. This means their pancreas doesn't produces insulin. It is necessary to take insulin when you are in the type 1 diabetes, as insulin is not producing by the body. Your body doesn't produces the hormone insulin, and without that your body can't properly get energy and fuel it needs from glucose, because this insulin itself is sending this fuel or this glucose into the cells. So as I told you that maybe the reason could be like they are providing insulin, but the cells have these insulin receptors na. Maybe those insulin receptors get inactivated, or these insulin receptors are not working properly, due to which we are sending insulin to the body. Still we can't send the glucose to the cells, because lots of glucose is there inside the cells, and we are sending insulin also into the body by injecting it. Still the receptors are not working. So how they will send glucose to the cells? So maybe the reason could be that. Okay. Now, pathophysiology of type 1 is could be genetic or autoimmune. Mainly, it is called as autoimmune disease or autoimmune factors. So now type 2 diabetes, this is important again. Type 2 diabetes mellitus, previously called as non-insulin dependent diabetes mellitus, because it is not dependent on insulin. It usually occurs in adulthood, common form of diabetes, which usually happen to people nowadays. That's why I told you, na, the very rare cases we used to see that small students are having. So that is only juvenile diabetes, but usually nowadays people due to after age or anything they could have this diabetes. Okay, type 2 diabetes, what is happening in this? First of all, stomach converts food to glucose. Glucose enters into the bloodstream. When stomach will convert into the food, food, whatever the carbohydrate we are taking from the outside, into the glucose. Glucose enters into the bloodstream. Glucose, your third one is pancreas produces insulin, but the body cannot use it efficiently. This happening usually in the type 2 diabetes. That's why I've told you there that we'll see ahead in the further slides. This is happening in this case. Pancreas produces the insulin. When this glucose enters into bloodstreams, we'll see that there is lots of glucose in the bloodstreams. Okay, so what happens? Insulin will be released by which cells of the pancreas?
Beta cell.
Yes,
Beta.
by the beta cells of the pancreas, insulin is released. But still, insulin is there, glucose is there, both are there. Still, our body cannot use it efficiently. What happens? Glucose unable to enter the body effectively. That the body means that tissues effectively, okay, or the cells. Glucose level increases as because these GLUT4 or these receptors, insulin receptors, are not working properly. Therefore, lots of glucose, the same condition, lots of glucose is there, lots of insulin is there, still unable to take that glucose. So this condition is called as I told, insulin resistance. So as glucose is not going inside the cells, so definitely again this condition will come. There will be high glucose level in the bloodstreams. So this high glucose level is called as high BP, sorry, high sugar level, which means diabetes again. So this type of diabetes known as type 2 diabetes mellitus. Okay, as I told that the main reason is insulin resistance itself. Okay. So it is written that blood cells do not respond effectively. Cells are not responding now. The problem is at the cell level in type 2. Insulin resistance, condition in which the body cannot use the insulin effectively. So again and again repeating the same thing since like I think so third, fourth slide. So you should learn it by heart. Now we'll go for third, gestational diabetes. The word gestational itself can be related to gynae, or you can like remember like that. So this is for at the time of the pregnancy. GDM we used to also call as, that is gestational diabetes. Gestational diabetes mellitus is a glucose intolerance of the variable degree with onset or the first recognition during the presence of the pregnancy. In simple terms, when we diagnose diabetes at the first time at the time of pregnancy, then it is known as gestational diabetes. 7% of the total pregnancy could have. Therefore, we used to say while pregnancy there could be the chances for females to have diabetes. Or can certain diseases, like sometimes to females at the time of the pregnancy, thyroid also increases. Okay, or they could have thyroid, but normally after that it will get released off or normalize. Okay, sevenfold increased risk of developing diabetes mellitus later. It could leads to further also diabetes mellitus, but if we'll have the proper lifestyle management, it could be normally normalized. Usually it get okay again. These
Ma'am,
yes, ma'am.
I have heard that if you're saying that in type 2 diabetes, this is insulin resistance. So is it like cell is not taking the insulin, right?
Yes, ma'am.
So is there any chance that by exercise, cell will start taking insulin?
Maybe because usually we used to do when we used to do yoga asanas and our practices, these are done because what happens? I will in management also I want to tell you this thing, but no problem. Now only what happens? The main important asanas for diabetes are most important set is Ardha Matsyendrasana asan. Most probably you all know Ardha Matsyendrasana asan, Vakrasana. No.
Yeah, yeah.
So you just visualize what happens, and while yogic counseling also at the time of giving them practices, what we ask them to twist like in Vakrasana, ask them that now insulin is just remember. Just memorize that pancreas is activating its beta cells, releasing insulin, etc. Like that. So this is how we are training their mind. Okay. So as I told you, everything is from the Manomaya Kosha. So their mind will be trained. This is the one thing. And when I will give them Surya Namaskar and all these practices related to this are actually 1 second charging. So related to diabetes mellitus, it will get stimulated. There all the organs will get stimulated. So the reason it could happen that their receptors can be get activated again. Okay. It will take time. They have to do regular practice and their lifestyle management along with their food pattern. Okay. Okay, ma'am. So insulin resistance main pathophysiology for your this. And for first one we have seen as this type 1 diabetes is as in type 1 diabetes what is happening? It is due to as I told you by the birth, so genetic or by age. Gestational diabetes done. Now symptoms, this as I told you, symptoms and all is not required for you, but these symptoms are very much required. Okay, very important. Three cardinal features for very important. One is polyphagia, polydipsia, and polyuria. By the name itself, you can understand poly means excess. Phagia, which is something related to your food. Okay, so polyphagia, which is excess hunger. Now, polydipsia can learn excess your this thirst or drinking it. Now, polyuria. Urea by name itself, you can understand excess urination. These three are the main majors. These are said as three P's of the diabetes. Okay, this is polyuria, excess urination, polyphagia, increase in appetite or excess hunger, and polydipsia, excessive thirst. Okay. And other symptoms are fatigue, blood, vision, etc., reduced weight, etc. This is are not so required, but these three are very important. Okay. Now, certain many complications of diabetes are there. This first is a microvascular. Will not go too much into them, but still we say that they could have the further related complications like diabetic retinopathy. Retinopathy is word itself. You can see here in the diagram. Diabetic retinopathy, which is related to eyes. They can lead to problem at your eye level. Okay, so there is blood vision. They can't see properly, or they have eyesight, weak eyesight, etc. Okay, because it affects the nerves of your diabetes. Because in diabetes, what is happening? It is working on whole all over the body because blood streams are all over the whole body and it is affecting the whole body. Diabetic neuropathy, here you can see neuropathy. It will affect the neurons of all over neurons of our body. So usually neuro actually that when diabetic neuropathy is there, they have the pain in the whole symptoms and they in whole nerves, and their these synapse and work the other are also not, neurons actually are not working properly. Why? They are getting pain or no proper signal traveling, etc. Now nephropathy, nephro word is related to what? Can anyone tell?
Neuron, ma'am.
Nephron.
Sorry.
Nephron. Ma'am,
Kidneys.
kidney is nephron.
Yes, kidney. Okay, so this is diabetic nephropathy. It will lead to the problem at your kidney level also. As high increase, it will get too much like liquidify now. Then further, there will be load on your kidney also, and it can affect this also. Cardiomyopathy, again, it can lead to your heart problem related to your heart. Other problems are also there, strokes, and also we have diabetic foot. They usually have pain at this foot level, etc. Glaucoma, other again related to your this one retinopathy itself. Okay. So Now, other macrovascular symptoms are diabetic footopathy and CAD, that coronary artery disease or peripheral vascular disease. Not required so much, but you should remember these names. Okay. Now, hyperglycemia, I have told you before only. What is hyperglycemia? Can anyone tell?
Glucose level raised in the blood.
Yes. Increased level of glucose. When it happens, increased level of glucose?
Ma'am, that is hyper, no, ma'am. This is hypo. Hypo means it
Hyperglycemia, that is
reduces.
high glycemic level. So I'll show you. This is the condition of hyperglycemia. That means high sugar level is there, and this is hypoglycemia. Hypo means less. Okay, not high. So what is happening? They have given the sugar level. You have to remember this when it is less than 55.
My mother used to have this condition, ma'am. So I used to give her sugar water every 2 hours.
Okay, but this is I when I was studying it, I thought that this is very rare. I didn't see that when this like low glucose also people used to have it, not like that. So you give them that syrups and all like that sugar and or something eating and like that. And
Yeah,
that
early morning she will completely go down, ma'am. So I used to apply honey on the tongue. It used to give
okay,
immediate glucose.
okay. So in hypo, low, you can remember with O, low have O word and hypo also have O word. So very easy to understand hypoglycemia and hyper word itself says that higher level of sugar. Drug overdose, other causes not so required. Skipping your meals because diabetes people have to have regular meals. Okay, they can't skip it. Eating less foods, late eating, excessive physical activities, which can further leads to obesity. Obesity can further leads to other diseases. Management, lifestyle management, proper diet, regular exercise you have to go because management will be similar to that of causes. We have to remove the causes. So for that we can do management, regular exercises that can lead to less fat and all obesity. Then further, no, it could be released. Now, regular glucose monitoring, we have to go for regular checkup. Diabetes people usually go for regular checkup of the glucose. Foot care, stop smoking and alcohol, drinks, drugs abuse, etc. Manage stress levels because everything is at the Manamai Kosha. Now, diet, fruits, avoid like all the sweet fruits are asked them to be avoided, like banana, jackfruits, etc. And vegetables, avoid your pumpkins, tropico, and potato, etc. Which can increase their carbohydrate or glucose level. Pulses, nuts with peanuts. When you can see all these brown rice, you should take the brown rices, etc. Because normal rice have lots of starch and all. Milk and yogurt or your curd, etc. Should be avoided. Thank you. This management will see ahead also, but still it is given because we need to avoid all the sweet foods, etc. Mainly
Ma'am,
cream. Yes, ma'am.
One question is coming into my mind that if person is having type 1 diabetes,
Yes, ma'am.
if person is taking insulin from outside, then do we have to like make them do physical activity?
Yes, ma'am. Why not? Because yes,
Yeah.
ma'am. Because we are in the yogic background, okay? So yoga will not only like we are not giving them insulin, we are giving them insulin because insulin is not producing inside their body. Okay, we are fulfilling that activity, but somehow we'll ask them to do yogic practices. It will somehow stimulate their body system and all. Then it can be released. Maybe I told you now that maybe the chances for getting okay, the person will not have that much problem. Okay, so to release or to relieve in that much high problem, we can ask them to do practices, and practices are required for everyone. So the level of the problem can be decreased, maybe not completely gone off, but the level of the problem will be decreased na? And mentally they will get okay. We are seeing IAYT module, we are seeing, so we have to work on all the koshas, not only to like asanas or exercise. We should not talk about like exercise because
yes, ma'am.
everything, what is the difference between exercise and asanas? Can anyone tell?
Exercise is kind of rigorous and asanas are like very smooth and slow
So
and steady process.
we can also do exercises with slow motion or like slow activities like that. Also, exercise could be given done, na? And
Yoga, but
we can
yoga,
even do asana practice. We can even do asana practice with a rigorous way also. There are different patterns of practicing asanas also. So, what is the main difference? Can anyone tell?
it includes mental and physical both aspect.
Yes, and more mental and physical, and most important is breathing. Okay, when we involve breathing practices along with our like asana, along with any of the physical activities, when we start focuses on the breathing, this is called as asana. When we are unaware of our breathing and just doing physical activities to exert our body, that is exercise. Okay, as simple.
Yes, ma'am.
It should be clear to all.
So, ma'am, for type 1 diabetic patient, we should not be giving exercise, right? Like rigorous exercise.
Not rigorous exercise, but normal diabetic asanas will give them, and no problem in giving any type of the asanas. Okay, if they didn't have any
Yeah.
other specific disease, because they are mostly small children, so they will not have any other problems. I think so, like other many other
Yeah.
problems in the old age they have, like people have, so they can do all the practices or all the asanas. Okay.
Okay, ma'am.
Yes.
Ma'am,
Yes, ma'am.
ma'am, actually type 1 diabetes only happen for children.
Usually happen for children, but what happened, I will see in my family itself, someone is there who said there is old man like 50, 60. They say that they have type 1 diabetes, but like I don't think so. They say that they have type 1 diabetes, but as I have studied from my teachers and all, I think so that this type 1 diabetes is there. They have type 2 diabetes, but maybe they are wrongly understanding they have type 1 diabetes. And but they said that doctors also said ask them this is type 1 diabetes.
Mostly, ma'am, mostly insulin is given for type 1 only, right? Type